Hi, this is Carl for Paws for the News. And welcome back to Paws for the News. I have the pleasure to be sitting beside Dr. Aerin Greidanus. And Dr. Aerin Greidanus, you're going to be coming out to the All About Pet show.
Yes, I'll be there, and hopefully you'll get a couple of opportunities to see me do a presentation on animal chiropractic and the benefits for your pet, small animal, large animal.
I understand over the years, chiropractic medicine has really made a shift towards the animal industry.
Yes, it's definitely growing. Since I went through the program and then did my extra certification in animal chiropractic, I mean, there's a class of 10 or 12 people that are coming out every year just in Ontario, and there are multiple schools in the States that certify as well, so it's really become much bigger and much more utilized by the general population. So.
And who are those people bringing their pets to you?
Some people are very proactive, and especially if the owners are chiropractic patients themselves, then they tend to think in that direction and think that there's a musculoskeletal reason for the condition, and that chiropractic can help a dog the same way it can help a person.
So they've gone through it, they felt the difference, so that validates their decision for their pet.
It does, and that's usually when I get the animals as first line. A lot of times it is a last resort. People go through the traditional medical veterinary care, they try, you know, pretty much everything reasonable, and then someone says, well, why don't you try a chiropractor? And I get those pets as well. And then there are those who are just very proactive. They're using they're training their dogs in agility or fly ball, or they're showing them and they're asking their dogs to do things that are very demanding or very repetitive. So then in order to keep their dogs on top of their game, they get them checked out by the chiropractor to make sure everything is tip-top shape. Joints can get jammed up and irritated, and a lot of times it's just because you do something over and over again. It's very repetitive. If you ask them to go over the jump and over the jump and over the jump, or up over the A-frame, if they slip on wet grass or anything happens, it's really important to just have that addressed, and the sooner you do it the better, because then it doesn't turn into a chronic type of issue. If the dog has to be on medication for anything else, it doesn't interfere with that. You can do it safely, it's very gentle, and it can really help improve their quality of life and keep them more comfortable, even if you can't, you know, rid them of the underlying arthritis that has set in. Osteoarthritis, or degenerative arthritis, which is the most common age-related change you'll see, is basically the joint starts to break down. So you have fluid inside of our joints, and there's cartilage on the two surfaces that are opposing each other, and that all starts to wear down. The fluid becomes a little bit less, so the joint, if you can imagine a dry, cracked joint as opposed to a nice fluid, lubricated, smooth surface. And when those two surfaces connect and they're a little bit rougher and they don't have that same lubrication, it's a lot more uncomfortable. And unfortunately with arthritis, it's sort of a vicious cycle, because once you have that, then the joint stiffens up and the muscles around it are protecting, but when it stiffens up, it lends itself to more degeneration as opposed to less. So when the joints are moving, they actually do better because it allows that fluid to lubricate the joint and keep things a little bit looser. When they stiffen up too much, then it just perpetuates the cycle. And one of the reasons to do a chiropractic adjustment is to break that cycle so that the joint can be moving and as loose as it possibly can be, so that it can function properly.
How does chiropractic medicine or therapy fit in?
The goal is to restore movement to a joint. Okay. So when I go through and assess a dog, palpate through the joints and see for which ones are moving well and which ones are moving poorly, I look for the ones that are moving poorly, and we just do a very gentle maneuver called an adjustment that allows a restoration of motion to that joint. So it pushes it just a little bit, not enough to be uncomfortable and not enough to put it, you know, beyond any range that it should be in, but just enough to restore some of that motion. And then animals are actually really good at taking that and kind of running with it. So if you introduce a little bit of motion, they're very good at taking it a little bit further and getting it to the next step. So I find actually that animals respond to chiropractic care faster than people do.
Do you suggest people take their pets take glucosamine? And
Yeah, and it depends on the case, certainly. Glucosamine supplements in the right dosages can be very effective and certainly can help with some of the pain symptoms as well. Glucosamine, as a general rule, is a good preventative supplement that dogs can take. I often give stretching exercises and general massage techniques that people can use at home to keep their dogs more comfortable in between their visits to see me, and just to give them something that they can do if something comes up or an injury starts, and then they have a basis where they can start. And certainly for the athlete dogs, stretching is vitally important. It's just like conditioning a human athlete as well. You have to make sure that you keep the muscles stretched and warm and working to their optimal to prevent injury where there shouldn't be one.
And would you also say then chiropractic therapy is also a preventative? Should people be starting with their pets younger for different treatments?
So yes, I would say that from a preventative standpoint, you can break that arthritis cycle early. So even in a young dog, I mean, they all do silly things. They all play and rough and tumble with other dogs, and certainly injuries can come up, and they're very good at hiding it. So you wouldn't even necessarily know unless you had someone who was trained in chiropractic assessment to go through and check all the spinal joints to make sure they're all functioning properly. It's very rare that I see a dog that is completely free of any joint restrictions. Usually it is younger, healthier dogs, but it's daily life. It just catches up with us eventually, and same with our pets.
Mm-hmm. Well, the reason why I had asked that question as well, because what I've come to realize is they're actually putting glucosamine now in puppy food.
Yeah, and they're just, again, it's just being preventative, and certainly we have more resources for it. We have more access to the services that are prevention-based as opposed to dealing with a symptom after it's already occurred. So, and chiropractic fits nicely within that model in terms of keeping the joints in the spine especially moving and functioning to their optimal ability.
So again, if for pet owners, what would you suggest that maybe they have a visit with you in the 2nd year, 5th year, 7th year of their life? Like, is there sort of an idea, even just to pop in and have an examination by chiropractic doctor?
Dogs are growing until they're about 2 years of age, and that's that sweet spot where if I check them before they're 2, I want to see them again shortly after they turn 2 years old. So
if everything goes okay on that visit, then what should they do? Like maybe once a year come in and visit with you?
Yeah, I usually recommend, if there's no problems, you're not seeing any major concerns, twice a year. What
can our viewers expect though? Because budgets by going to doctors and alternative therapy programs, it can start to get quite expensive. And what does it cost to come and see you?
It really depends where you are. I personally charge $60 for an initial visit on a small animal, and then $40 for any follow-up.
That's quite reasonable.
To me, it's a reasonable amount. If you're in Toronto, it might be a little bit more expensive because it costs them more to run their business where they are. But I'm in a little bit north of the city, so my costs are a little bit lower, so I can extend the same cost. A typical initial visit is usually about 20 minutes to half an hour to go through a case history and just assess the dog and do a treatment. And cats are a little bit faster than that because they're smaller, and the smaller the dog, obviously an assessment will go quicker. But in follow-up visits, I usually schedule about 15 minutes time, and that seems to be enough.
And do you go to people's homes, or do they come to see you?
Both. I do make house calls, and certainly not every chiropractor will do that, but I have found that there's a need for that, so I do have it as part of my availability. And then I also have certain locations across this area, so Gravenhurst, Orillia, Waverley, Lindsay, and through that area, and then Minden as well, where I can see dogs, have them come to me. I always do sort of an overall view of how the spine is moving, looking for a little bit of spring in the spine.
And by putting your thumbs in there, what exactly is going on? So
now I'm assessing each spinal vertebrae and the joints between them individually. And I look for flinching, I look for tenderness. You might see a dog pull away a little bit. So actually I found a little bit here. It might not show well on the camera. There's a little spot in here, so it's just a quick adjustment. Good girl, Midnight.
And what did you just do?
So all I'm trying to do is introduce that motion back into the joint. So when I put pressure through that one spot, it wasn't moving well, and I could feel her ligaments and muscles around it. They were a little bit tense. So, and just going through and doing an adjustment that seems to loosen it up. And you know what, if I were to check her again in about an hour, you probably wouldn't find it anymore. And I always check to the jaw before I finish up. Hers is pretty good. Because so many of the muscles surrounding the joints of the jaw are close to the top of the neck. So those two things I often find will correspond to each other. Good girl. One there, Midnight. Good girl. And that's it. You're all done.
Well, Dr. Aerin Greidanus, thank you so much for sharing all this insight for our viewers for Paws for the News, and we're really excited about having you being a part of the All About Pet Show 2013. It's an amazing show. Come and see. We're going to have Aerin there on both the Friday and the Saturday, the 29th and the 30th. And if you have any information that you require any further, you can definitely get more insight at the show. She's going to be publicly speaking, and then she's going to be doing one-on-one interviews. So again, that's the 29th and the 30th that Aerin will be there. And also you can visit her website again at
animalspinedoc.com.
Okay. If you need any information prior to the show,
by all means, contact me.
Sounds good. Thank you so much.
Thank you very much.
It was a pleasure.
We'll see you in March.
Okay. Stay tuned for another episode of Paws for the News.
Heel, fetch, sit, stay, a good old day, doing what you say. You're my best friend. There's time to talk and there's time to walk. We're going off leash. I'm gonna run.